Here is what to expect for your upcoming magnetic resonance imaging MRI appointment. Register at the NNI Neuroradiology Department and proceed to the waiting area. Next, you'll be guided to a changing room. Change into a gown, as your clothes may contain certain fabric that will affect the safety and accuracy of the scan. Remove all items such as your bra, colored contact lenses, dentures, glasses, hearing aids, jewelry, medicinal patches, piercings, watch, and wigs. Place your belongings in a locker and keep the key safely with you or a caregiver. The radiographer will ask you questions about your health and medical history to assess if it is safe for you to have an MRI scan. For your safety, it is important that you tell us if you have any implants. Some patients will need a dye injected for clearer images to be taken. Our staff will advise if it is needed and prepare you for the process. Inform us if you have any allergies, kidney issues, or take medication for diabetes. You may also need a blood test before receiving the injection to know how well your kidneys are functioning and whether it is safe to proceed. Although uncommon, some patients may have an allergic reaction to the dye and experience symptoms such as rashes and breathing difficulties. Medications may be given to reduce the probability of a reaction. Inform our staff or seek immediate medical help if you experience any discomfort. Once ready, you will be brought to the MRI controlled area for your scan. Before you enter the room, the radiographer will conduct a final check with a metal detector. For your safety, never bring in items such as phones or locker keys. Leave personal items in your locker and pass your key to a caregiver or the radiographer. Inside the MRI room, you will be given a hygiene cap, call bell, earplugs, and headphones. Let the radiographer know if you have a fear of small spaces. For some scans of the brain and neck, a frame, also known as a coil, may be placed over the head and neck. Once you are ready, the radiographer will exit the room to start the scan. The radiographer will operate the scanner from outside the room and monitor you throughout the scan. The scan takes between 30 to 90 minutes, depending on the type of scan and the number of images taken. It is important to keep your body very still throughout the scan, as movement can cause blurred images. If this happens, you will need to repeat the scan, which will make your appointment longer. It is common to feel vibrations and hear loud noises during the scan. Here are some sounds you may hear. Once the scan is completed, our staff will assist you before directing you back to the changing room to change and collect your belongings. You can resume your daily activities after the scan unless advised otherwise. If you received a contrast injection, drink plenty of fluids to flush out the contrast unless you are on fluid restrictions. Monitor for any signs of allergy. A doctor will review the scans and share the results with you at your next appointment. Here are some frequently asked questions about your appointment and MRI scans at the NNI Neuroradiology Department. Why must I wait even when I have an appointment? We understand waiting can be frustrating. We will try our best to scan you at your appointment time, but sometimes we need to attend to emergency cases. We seek your understanding for such delays and will attend to you as soon as possible. Why do I need to change into a hospital gown? Your clothes may contain fabric that will react to the scan, potentially causing burns to your skin. In addition, metal components in your clothes may react with the MRI machine and affect the scanned image. Why do I need to remove medicated patches? Medicated patches may contain metal and materials that may irritate the skin and affect the scan. Removing them ensures the accuracy of the scan and your safety. Why am I asked if I have any tattoos? Tattoos can contain metallic compounds that will react to the scan, potentially causing skin irritation and burns. Therefore, it is important to let us know if you have any tattoos so that we can provide you the necessary advice during the examination. Will I feel any pain during the MRI scan? The scan is painless. For those who need a dye injected, you may feel some discomfort, such as a warm sensation when the dye enters your body. This is usually mild and temporary. We hope you have a pleasant experience at the National Neuroscience Institute.